Today we're going to be doing an abdominal assessment on our patient. I will first start by asking if there are any cultural or personal beliefs that I need to be made aware of prior to us beginning. I will then have my patient lie in a supine position, keeping in mind that my patient may be uncomfortable laying in this position, especially if they are coming in with abdominal pain, and I could provide some extra pillows and things of that nature to promote comfort. I will begin by letting my patient know that I'm going to lift up their shirt to begin inspection of the abdomen. And I am looking for things like abdominal distension, which could lead me to maybe think we have a hernia or urinary retention or a mass. I will look for palpitations coming from the midline, which could be indicative of an aneurysm. I would look for discoloration, so things like Grace Turner along the flank, which is indicative of internal bleeding or pancreatitis, and then things like colon sign, which is discoloration to the periumbilical area, which would also be an abnormal finding with possible severe pancreatitis. You would alert the provider of any of these abnormal findings. If all is well, I will then move on to auscultation of the abdomen. So I will use my stethoscope to listen in all four quadrants, moving clockwise, expecting to hear about 5 to 30 sounds a minute. I am making note of any hyper or hypoactive bowel sounds I may hear, as this could be an abnormal finding in a patient with a normal gastrointestinal history. I will then use the bell of my stethoscope and listen to the abdominal aorta. I am listening for breaths, which would sound like a swooshing or turbulent sound, and this would be a normal finding. I am also listening for the same sound where the renal arteries are located. If all is well, I will then let my patient know that I will be palpating on their abdomen. I will begin with light palpation so that the patient can get comfortable with my sensation, and then I will alert the patient that there will be more firm palpation. As I'm pressing, I am watching for tenderness that the patient may exhibit. I am also noting any masses or firmness that I may see and having the patient alert me if there is any pain or discomfort in those areas. I will then do some percussion in these areas as well, checking for the liver border on the right. I will percuss, listening for dullness and tympanic sounds. And then I will move over to the left where the spleen is located. You also will fill and push in those areas. On the left, you would actually hope to not be able to fill the spleen border because that would be a sign that we have splenic enlargement. When doing your palpation as well, we would look for Murphy's sign on the right, which is pushing pressure on that right up where the liver is located, and looking for cessation of inspiration by the patient. This would be where they're having such severe pain, they pause their breathing because of that. That would be a positive Murphy's sign, which could be indicative of cholecystitis, and we would alert the provider. There is also something called the Roxine sign, where we would apply pressure to the left lower quadrant above the hip bone. You would press and release, and if there is any rebound pain on the right lower quadrant, that could be a positive Roxine sign, which would be indicative of appendicitis. This would, of course, be an abnormal finding, and especially if the patient is presenting with other symptoms, you would want to alert the provider immediately. If all is well in that area, if the patient is presenting with any sort of urinary issues, flank pain, dysuria, we would want to do a costal vertebral assessment. So I would have my patient set up if they're able to, and I would then apply pressure to the costal vertebral region and have the patient tell me if they experience any discomfort. You can lay back. A positive sign could be indicative of kidney stones as well as urinary inflammation, like a urinary tract infection. After assessment is complete, I then gather some subjective data. I would ask my patient, are you having normal bowel movements for you? Are you going regularly? Do you have mucus or blood in your stool? Any issues with nausea and vomiting? And we would also dive into the urinary system as well, assessing if there's any dysuria going on, burning sensation, or issues getting the stream going. I would then document my findings and alert the provider of any abnormalities.